Chapter 15: Diagnostic Procedures, Pharmacology, and Complementary Medicine. With diagnostic procedures, we use a multitude of different techniques to assess our clients, and we start off with observation. We're looking at the overall appearance, which includes a number of factors, such as how appropriately is the patient dressed? Is there any body odor? Are there any signs of possible difficulties with self-care? We look at their emotional affect, and this refers to the patient's expression, their tone of voice, their mood, their emotions. How do they walk? And this includes looking at their gait. Are they unsteady? Are they limping? Is there any type of difficulty? Next, we look at the vital signs. With the temperature, the average normal body temperature is going to be approximately 98.6, with an oral body temperature higher than approximately 100 degrees or 100.5 degrees is considered a fever. Hyperthermia is an extremely high body temperature, while hypothermia is an abnormally low body temperature. With the pulse, we're assessing the rhythmic pressure against the walls of an artery, which is caused by the beating of the heart. In adults, a normal resting heart rate is 60 to 100 beats per minute. Then we assess the respiratory rate, which is the number of complete breaths per minute. A single respiration will consist of one inhalation and one exhalation. We assess the blood pressure, which is the force of the blood against the walls of the arteries, and it's measured using a sphygmomanometer, which is recorded as a ratio with the systolic blood pressure over the diastolic reading. We need to assess pain. It's considered the sixth uh, vital sign. In the hospital, pain is considered the fifth vital sign. Well, I was counting the oxygen saturation as number 5, but pain is definitely one of the vital signs. We rate it on a scale from 0 to no pain to 10, which is the most severe pain the client has ever experienced. Acute pain is pain that comes on quickly. It can be very severe, but it usually lasts only a relatively short period of time, whereas chronic pain can be mild to severe, but it persists over a longer period of time than acute pain. And unfortunately, it is resistant to most medical treatments. Another method of assessment is auscultation. This is where we listen for sounds within the body, usually performed using a stethoscope. We listen to respiratory sounds. One sound we may hear will be rales, which are kind of like crackles. They're abnormal crackle-like lung sounds, and rhonchi is coarse rattling sounds that kind of sound like snoring. Stridor is an abnormal high-pitched breathing, may have a bit of a musical sound to it, but it's caused by a blockage or partial blockage in the throat or the larynx. We also want to listen to heart sounds. We're listening for that lub-dub, which is the normal heart sounds. We may hear a bruit, which is an abnormal sound, or a murmur that's heard when we auscultate an artery. A heart murmur is going to be an abnormal heart sound, and it's most commonly a sign of defective heart valves. We also auscultate the abdominal sounds, also known as bowel sounds. Absence of these sounds can indicate an ileus, which is the stoppage of intestinal peristalsis. In other words, that regular wave-like movement. of the intestines. Additional procedures that we might use in our assessment include palpation and percussion. Palpation is an examination technique where the examiner feels the texture, the size, consistency, and location of certain body parts. Percussion is another diagnostic procedure that determines the density of the body part by the sound produced by tapping the surface with fingers. There are some instruments that are used with a basic examination, such as an ophthalmoscope that's used to examine the interior of the eye, or an otoscope that's used to visually examine the internal or the external ear canal and tympanic membrane, whereas a speculum examines the opening of a canal or cavity by making it larger. And the stethoscope is the tool that we use to listen to sounds within the body itself. There's a variety of positions that we will put our clients in to examine them. We have the horizontal recumbent position, also known as the supine position, the dorsal recumbent position, which is lying on the back, face up with the knees bent, the lithotomy position, which is lying on the back, face up with the feet and legs raised and supported in stirrups. The prone position is lying on the abdomen face down. The Sims position is lying on the left side with the right knee and thigh drawn up, with the left arm placed along the back. And we have the knee chest position, which is lying face down with the hips bent and the knees and the chest resting on the table. We have a variety of other positions, such as the Fowler's position or the high Fowler's position, which is basically elevation of the client's head. Trendelenburg position would be lowering the client's head higher than the feet, and reverse Trendelenburg would be just the opposite, raising the head higher than the feet. And this is kind of keeping the body in a supine position while making those bed changes. We also do a variety of blood tests, and we do this through phlebotomy, also known as venipuncture, which is puncturing the vein for the purpose of drawing blood. We can also do an arterial stick where we puncture an artery, and this will obtain arterial blood. A capillary puncture is used only when a small amount of blood is needed as a specimen. So some of the blood tests that we might do is what we call a CBC, or a complete blood cell count, which is a series of tests performed as a group to evaluate several blood conditions, such as red blood cells, white blood cells, etc. We can do an erythrocyte sedimentation rate, also known as an ESR, or sometimes called a SED rate. This is the speed with which the red blood cells separate from the plasma and fall to the bottom of a specialized test tube. And basically what it's going to do is identify if there is inflammation. A hematocrit is the percentage by volume of a blood sample occupied by red blood cells. A platelet count will measure the number of platelets in a specified amount of blood. The red blood cell count will determine the number of erythrocytes in the blood. A total hemoglobin test is usually part of a complete blood cell count, as is the white blood cell count, which determines the number of leukocytes in the blood. The white blood cell count differential is part of the CBC, which indicates the percentage of total white blood cells, which type. There's 5 different types of leukocytes. such as neutrophils and eosinophils, etc. We can do a basic metabolic panel, or a BMP, sometimes referred to as a profile 8, which is basically a group of 8 specific blood tests, which identifies the current status of the kidneys, the electrolyte balance, the blood sugar, and calcium levels. A blood urea nitrogen test, or BUN, will measure the amount of nitrogen in the blood due to the waste product urea. We do cross-match tests to determine the compatibility of donor blood and recipient blood before a blood transfusion is done. A C-reactive protein test, or CRP, is another blood test that can identify high levels of inflammation within the body. A lipid panel, or lipid profile, measures the amounts of total cholesterol, high-density lipoprotein, or HDL, the low-density lipoprotein, or LDL, and triglycerides in a blood sample. The prothrombin time, or PT, is also known as a ProTime, and this is a coagulation test. The serum bilirubin test will measure the ability of the liver to take up, process, and secrete bilirubin into the bile. The thyroid stimulating hormone assay will measure the circulating blood levels of the thyroid stimulating hormone, also known as TSH. One of the arterial blood tests that we will do is an arterial blood gas analysis, or ABG, which measures the pH, oxygen, and carbon dioxide levels of the arterial blood. There's some genetic blood tests that we can do that are done using blood, but we can also use saliva or hair, amniotic fluid, or other tissues. And these look at a single gene in a person's DNA. The genome testing, or genomic testing, does the whole genome screening and uses DNA to identify genetic variants that may increase the risk of certain diseases or disorders. Genome testing can also be used to pinpoint unexplained conditions suspected to be genetic in origin. So then we can also do a urinalysis. A routine urinalysis will screen for urinary and systemic disorders, with a microscopic examination that provides a more detailed testing. We may look at pH values of urine, with a normal pH being 4.5 to 8.0. If it's below 7, we consider it to be acidic and indicative of acidosis. If it's above 7, we consider this to be alkaline, which is indicative of a urinary tract infection. We look at the specific gravity, which indicates the amount of wastes, minerals, and solids present in the urine specimen. A low specific gravity means that urine is pretty dilute. We see this with a disease process called diabetes insipidus. A high specific gravity means the urine is really concentrated, and this client may be dehydrated or have liver failure or shock. There are some conditions and drug use that's identified through urinalysis, such as albuminuria, which is the presence of the protein albumin in the urine. Bacteriuria is the presence of bacteria in the urine. Calciuria is the presence of calcium in the urine. Creatinuria is the increased concentration of creatinine in the urine. Glycosuria, presence of glucose in the urine. Hematuria is the presence of blood in the urine. And again, look at some of these words and break them down. We know that hema is blood, and urea has the urine. Ketonuria is the presence of ketones in the urine. Proteinuria is the presence of an abnormal amount of protein in the urine. Pyuria, presence of pus in the urine. We can also do urine culture and sensitivity test, which will identify the cause of a urinary tract infection, but it also will help identify which antibiotic the cause is going to be most susceptible to. We can also do a stool analysis, which will examine the physical and chemical properties of feces, such as a stool Gram stain, which tests for bacteria in a sample, or a stool guaiac test that looks for blood in the stool, or a fecal fat test that analyzes how much fat is in the sample, and this helps us determine how well the body is digesting fat. It determines if the fat absorption functions of the pancreas and gallbladder are working, for example. There's a couple of procedures that we can do, surgical procedures that are not your usual, let's make a large incision and cut the client open. And one of these is an endoscopic surgery, which is performed through very small incisions with an endoscope and specialized instruments. This endoscope is a small flexible tube that has a light and a lens on the end, versus a laparoscopy, which is an examination of the interior of the abdomen. The laparoscope will then be passed through another small incision. These laparoscopic procedures will explore and examine the interior of the abdomen. They can take specimens to be biopsied, or even perform surgical procedures such as a laparoscopic cholecystectomy, which would be the removal of the gallbladder through a laparoscopic procedure. Or we can do a laparoscopic assisted vaginal hysterectomy. So a variety of laparoscopic procedures that can be done surgically. Centesis is basically going to be the removal of fluid. So we have the abdominocentesis, which is a surgical puncture of the abdominal cavity to remove some of this fluid. The arthrocentesis is the puncture of the joint space and basically removes synovial fluid. A cardiocentesis will puncture the chamber of the heart for diagnosis or therapy. A pericardiocentesis is the puncture of the pericardial sac for the purpose of removing fluid. And a thoracentesis is the puncture of the thoracic cavity to remove fluid collection in the lung linings, usually between those linings. We can do a biopsy, which is a removal of a small piece of living tissue that is then sent to the lab for testing, and we use this to confirm or establish a diagnosis. And it can also be a fluid sample. We can do this through a variety of biopsy techniques, such as a fine needle aspiration that uses a very thin needle that's inserted through the skin and into the intended fluid or tissue, or a core needle biopsy that uses a larger needle or collects more of the fluid or tissue. We can do that excisional biopsy shown in the picture here, where they just basically remove the suspected area. They can do a core biopsy using a special tool that goes in and removes the core of a lesion. And these are just some of the biopsy techniques. Imaging techniques. We may use contrast medium to help make structures more visible. This would include some radiopaque dyes. It doesn't allow X-rays to pass through it, for example, or radiolucent, which is an air or nitrogen gas that does allow X-rays to pass through. We can use an intravenous contrast medium where we inject the medium into the vein and it makes the flow of blood and organs visible. Barium is a radiopaque barium sulfate compound that's used primarily to visualize the gastrointestinal tract. So we have radiology, which is the X radiation or ionizing radiation, which is very beneficial in producing diagnostic images and in treating cancer. However, excess exposure is dangerous and those effects are cumulative. In other words, they can cause cancers. Interventional radiology uses radiographic imaging to guide a procedure, such as a biopsy. Radiographic positioning helps place the body and the body part that is closest to the X-ray film. And radiographic projection describes the path that the X-ray beam follows through the patient's body. And of course, we have dental radiography, where we have extraoral radiography, where we place the film and then expose it outside of the mouth, or panoramic radiograph that shows all of the structures in both the dental arches in a single film. Intraoral radiography is where the film is placed within the mouth and then exposed by a camera positioned next to the exterior of the cheek. Additional imaging techniques include computed tomography or the CT scan, or we have that computed axial tomography or the CAT scan. This basically rotates around the client and produces multiple cross-sectional views of the body. The images are viewed on a monitor, they're stored as digital files, or can be printed as films. They are more effective than the MRI for imaging compact bone, and these scans can be performed with or without contrast dye. The magnetic resonance imaging is the combination of radio waves and a strong magnetic field. This is also known as the MRI, and it creates signals that are sent to a computer. Excuse me. The closed MRI produces the most accurate image, and the open MRI is designed to be less confining, and it's more comfortable for patients that suffer from claustrophobia. We also have the magnetic resonance angiography, or the MRA, which is also known as a magnetic resonance angio, that helps locate problems within blood vessels throughout the body. Fluoroscopy is another imaging technique that helps us visualize parts of the body in motion, and it will project X-ray images on a luminous fluorescent screen. Luminous meaning glowing, and it's used with or without a contrast medium. It's used to see movements in the intestines and the joints or blood flow through the veins and arteries, and it can be viewed normally or in slow motion. With ultrasonography, this is ultrasound or diagnostic ultrasound. The sonogram is an image that is created by ultrasonography. Uses of ultrasonography, we often use it to evaluate fetal development, to detect gallstones or blood clots. We can also confirm a mass found on a mammogram. We can show structures in the abdomen, etc. Echocardiography will help evaluate the structures and the motion of the heart with the use of ultrasound. That fetal ultrasound, the image will help evaluate fetal development. We can get a 3D or 4D ultrasound where we have an almost photograph-like image. We can do transesophageal echocardiography, or a TEE, to help evaluate heart structures. So sonography is very beneficial. Then we talk about nuclear medicine, where we use radiopharmaceuticals either for diagnostic or treatment purposes. It does contain radioactive materials called radioisotopes. That nuclear imaging contains radionuclide tracers or radioactive tracers. They emit gamma rays and help generate an image. Nuclear scans, called a scintigram, we can do this for a bone scan to help identify new areas of bone growth or breakdown. A thyroid scan that uses radioactive iodine. We can do a single photon emission computed tomography that helps produce a 3D computerized reconstructed image, and it shows perfusion through tissues and organs. It's used primarily to view the flow of blood through the arteries and the veins in the brain. Very useful in diagnosing blood-deprived areas of the brain. And then the positron emission tomography, or the PET scan, helps combine computed tomography with radionuclide tracers. And pharmacology. There are frequently used drug administration abbreviations and symbols, and many of these abbreviations will come from Latin terms, but remember that the Joint Commission does have the do not use abbreviations that are designed to cut back on medication errors and eliminate some of those commonly confused abbreviations. And always, when in doubt, write it out. So with prescription and over-the-counter drugs, we know that prescription drugs can legally be dispensed only by a pharmacist with an order from a licensed professional, while over-the-counter or OTC drugs can be purchased without a prescription. Generic drugs are going to be named for the chemical structure. They're not protected by a brand name or a trademark. They're usually less expensive. Whereas the brand name or the trade name drugs are those that are sold under the name that is given to it by the manufacturer. A formulary is what we determine. They're basically prescription drugs that are covered by a specific healthcare plan. In other words, it's a list. The physician's desk reference, or PDR, is the most commonly used drug information guide. And terminology that's related to pharmacology includes terms such as addiction, which is a compulsive, uncontrollable dependence, controlled substances, which are addictive prescription medications and illicit drugs. Drug tolerance is where the body has become accustomed to a medication. An adverse drug reaction is also known as a side effect. It's something that commonly will happen with the administration of this medication, but is not necessarily harmful to the client, but may be very irritating, for example. Adherence or compliance is the patient's consistency and accuracy in following the prescribed regimen. A contraindication, this will be a condition that makes a medication or a treatment dangerous or ill-advised in certain cases. In other words, you don't give it to a client that has this situation, or this is a treatment that if we do this, it could cause harm to a developing fetus, for example, etc. A drug interaction. This is the result of drugs that interact with each other, and they can provide some unwanted and sometimes wanted actions of a drug. Synergism is going to be the interaction of two drugs taken together. So basically, it enhances the effectiveness of both. For example, diuretics a lot of times are administered with antihypertensive medications to help improve the action of decreasing the blood pressure. An idiosyncratic reaction is an expected reaction to a drug that is peculiar just to that individual. In other words, not everyone has this reaction. Palliative is a substance that eases the pain or severity of the symptoms. A paradoxical reaction is going to be a treatment that yields the opposite of the normally expected results. For example, we administer diphenhydramine, and one of its normal side effects or adverse effects is sedation. But in some people, we have a paradoxical reaction where it actually will stimulate them versus sedate them. Placebo is an inactive substance that's administered only for its suggestive effects. In other words, I tell you I am giving you something that will ease your pain, and it's nothing but, let's say, a sugar pill, a placebo. But the suggestion that it will ease your pain helps it ease the pain. An antipyretic is a medication that is administered to prevent or reduce fever. Anti-inflammatory medication helps relieve inflammation and pain. Then we have medications for pain management. These are analgesics. It's a class of drugs that relieve pain without affecting the level of consciousness. And opioids or narcotics, these are available by prescription only to relieve severe pain. Non-narcotic analgesics, such as acetaminophen, reduces pain and fever, but does not relieve inflammation, whereas the non-steroidal anti-inflammatory drugs, also known as NSAIDs, will help control pain by reducing inflammation. We have anticonvulsants and antidepressants that sometimes are used as chronic pain management treatment. We have pain relieving creams or topical analgesics that are applied to the skin. Oral analgesics will relieve pain in and near the mouth. We have transcutaneous electrical nerve stimulation, also known as TENS units. These are devices that will deliver small electrical impulses that interfere with the pain transmission. There's different ways to administer drugs that has to do with pharmacology. We can do it by inhalation, which administers vapors and gases, and we do this through the nose or the mouth. Oral administration are medications taken by mouth. Rectal administrations, we insert a medication into the rectum and then it's absorbed through the rectal tissues. Sublingual administration places a medication under the tongue, and that medication is not swallowed, but it is allowed to dissolve slowly. Topical application is a medication that is applied to the skin. Transdermal medication, we use a patch to deliver the medication and we apply it to unbroken skin. Parenteral administration is basically uh, administering this in a variety of ways. We can do it subcutaneously. This is injected into the fatty layer just below the skin. We can do it intradermally, which is injected into the middle layers of the skin. Intramuscularly is injecting it directly into the muscle tissue, or intravenously injecting it directly into a vein. One way we can inject it into a vein is through a PICC line, which is an abbreviation for a peripherally inserted central catheter. One way to deliver medications is by a bolus infusion. This is usually done intravenously, where we give a single concentrated dose. There are some non-medication prescriptions that may be made by the provider, and this will refer to products that are prescribed but are not medications. They may or may not be covered by insurance, and it includes some items such as a walker or a Hoyer lift, a hospital bed, oxygen, a stool riser, etc. And sometimes, if they are prescribed by the physician, insurance will be more likely to cover it, but again, that's not a guarantee. And then wearable medical devices are devices that a patient can use to track various signs and symptoms. And the FDA approves these devices. They can be purchased by a consumer directly, or they can be used exclusively in the healthcare setting. There is a wide range of complementary and alternative medicine, such as allopathic medicine, which is conventional or Western, medical practices, and healthcare. Alternative medicine is defined as healthcare that's used in place of allopathic approaches, while complementary medicine is healthcare used to supplement allopathic approaches. Integrative medicine is both allopathic and alternative medicine, and holistic is an approach that considers the whole body and its environment. When we're talking about wellness, this is actively working toward a state of being in good physical and mental health. So, with alternative medicine, we have the Ayurvedic medicine, which is a traditional Hindu system of medicine. We have traditional Chinese medicine and ancient Chinese medicinal treatments. Kinesiology, which is the study of body movements and physical activity. For example, physical therapists and uh, physical therapy assistants have to go through a degree of kinesiology study. Naturopathy is a naturopathic medicine supporting the body's own innate healing ability and the healing power of nature. Herbal medicines or phytotherapy uses plants as a dietary supplement. Homeopathy uses substances created from plant or mineral products that's diluted in 1,000-fold in water or alcohol. Some complementary medicines include mind-body therapies such as biofeedback, which is a patient-guided treatment, and guided imagery, which is visualization or imagery. Hypnosis is a state of focused concentration, and mindful meditation, awareness of the thoughts, emotions, and physiological responses. Some energy therapies include acupressure or touch therapy, acupuncture using the acupuncture needles, Qigong movement, breathing techniques, and meditation. Reiki is the transfer of healing energy. Chiropractic manipulative therapies use a mechanical spinal adjustment. And osteopathic manipulative therapy uses a mechanical spinal adjustment in conjunction with conventional medical therapies by an osteopath. Excuse me. Therapeutic massage. Uh, there may be a craniosacral therapy where we use gentle touch to relieve tension, stress, and trauma. A myofascial release, which is a specialized soft tissue manipulation to help ease pain. Neuromuscular therapy is a soft tissue manipulation focusing on applying pressure to specific trigger points. And then, of course, we have abbreviations that are related to these diagnostic procedures: nuclear medicine and pharmacology. There's a few of them listed here, but in table 15.4, in the text, you'll have a larger list. Realize that there's a lot of terminology that, as a healthcare provider, no matter what type of healthcare you are involved in, basically you need to be familiar with. So, doesn't mean you have to memorize all of these, but you need to at least be familiar with them. And in addition to that, being familiar with the different types of prefixes and suffixes and word roots, so you can help break down those words to figure out what it is you are looking at without always knowing the specific definition.